So for my case presentation, I am going to be presenting on a 2-year-old male brought to the clinic by his mother with a rash to his right thigh, right chest, and lower back. The mother states the rash started 3 to 4 days ago and is getting worse. Review of symptoms. General, child is age appropriate with no developmental concerns, stated by mother, no unusual weight gain, no unusual weight loss, no temperature sensitivity, no general malaise or fatigue reported. His skin currently has the rash previously stated to the right chest, right thigh, and lower back. No edema or changes in soaps, detergents, or lotions mentioned by mother. Child does have a history of eczema. Head and neck. Mother denies any complaints of headaches, no injuries, no stiffness, no pain, and no masses. Ears, eyes, nose, and throat. Mother denies child complaining of sore throat, sores, or lesions. Denies any complaints of eye pain, no itching, no redness, no discharge, no swelling. Mother denies child complaining of ear pain and or discharge. Denies congestion, nosebleeds, rhinorrhea, or sneezing. Respiratory. Mother denies any history of asthma, no cough, no difficulty breathing. Cardiovascular. Mother also denies any abnormal history, no palpitations, no syncope. Gastrointestinal. Mother denies complaints of stomach pain and or nausea and no diarrhea. No abdominal pain complaints by the child, no bloody stools or constipation. Genitourinary. Mother denies abnormal or any concerns, any abnormal history or any concerns, no dysuria, no increased urge or frequency, no blood in the urine, and no discharge. Musculoskeletal. Mother denies any abnormal history or concerns, no pain in joints, no swelling, no decrease or limitation in range of motion. Neurological. Mother also denies any abnormal history or concerns. Endocrine. Mother denies any abnormal history or concerns. Hematological. Mother denies any abnormal history or concerns, no bleeding, no easy bruising, no swelling of lymph nodes. Psych. Mother denies any issues, no anxiety, no depression, no difficulty sleeping or hyperactivity that she has noticed. The patient is currently taking Singulair for seasonal allergies. He takes 4 milligrams PL Q24 in the morning. Allergies. Child has no known drug allergies, but he does have seasonal allergies. As previously mentioned, he is taking Singulair. Past medical history. Mother denies any past medical problems or hospitalization since birth. Family history. No abnormal family history noted by mother, and no current family history of any illnesses or rashes. The child does live with his mother, father, and older brother. He currently does not attend school or daycare at this time, but previously did attend daycare. Mother denies any social concerns, and all of his vaccinations are up to date. Working differentials were contact dermatitis, shingles, and scabies. The child's temperature is 97.6. He weighs 28.6 pounds, which places him in the 25th percentile, and his height is 94 centimeters. Upon general exam, generally the patient appears with no general malaise or fatigue. He's appropriate and polite. On his skin, he does have a vesicular rash noted to the right inguinal crease, his right lower back, and his right thigh. No bruising or peeling noted around the rash. No other rashes or petechiae noted anywhere on the body. Cardiovascular, he has normal sinus rhythm, no bruit or thrills. Respiratory is even and unlabored, no wheezing noted, no rales or rhonchi. All other areas were clear to auscultation. Gastrointestinal, his abdomen is soft, non-tender to palpitation, non-distended, no rigidity, no guarding, no masses present. Bowel sounds are present in all 4 quadrants, no nausea or vomiting. No lab tests were ordered at this time. Our assessment concluded that the child had unilateral lateral thoracic exanthem, ICD-10 code B08.8. The differentials that were refuted were contact dermatitis. The refuting data was there was no change in soaps, lotions, or detergents, no exposure to any outdoor plants or any objects out of the child's norm. Shingles, the refuting data included the fact that it was not The rash was not bothersome to the child. He had no itching or complaints of pain, no fever, no other symptoms of shingles. And scabies, the refuting data was that it was a fascicular rash with no itching or complaints by the child. The plan, medication is to continue with the singular to help control any itching or swelling that may occur. Continue with the 4 milligrams PO Q24 hours. Diagnostic studies, as mentioned previously, no lab test or diagnostic studies were ordered at this time. Modalities that can help with the rash are baths in lukewarm water and keeping the skin very hydrated with bland emollients. And of course, if it becomes itchy, try to help the child not to rub or itch or scratch. Follow-up, we did tell the patient to return to the clinic if signs or symptoms did not improve. We did explain that it is a self-limiting condition and it usually goes away within 2 to 5 weeks. And when it does clear up, it will have very lightly fine peeling of the skin, but nothing that will result in any skin damage or scarring. Education, again, had to do with the previous mentioned, as well as not using hot water for baths, keeping skin hydrated, loose clothing so that there's no rubbing or irritation occurring. Education to the mother was giving on not using topical steroids. The rash is self-limiting and will resolve on its own. Topical steroids are not helpful in any way. No referral was necessary at this time. There was a clinical guideline that was used for final diagnosis, and it stated to use an antihistamine and bland emollients for any itching or swelling that may occur. I think that my initial differential diagnosis of scabies after the fact, now that I look back at pictures of scabies, was not a good working differential diagnosis. My first thought initially was shingles, as was my preceptor's first thought. We actually did have the doctor of the clinic come in and he gave our final diagnosis because we were a little dumbfounded on what it could have been. So after he gave our diagnosis, we did research and look up the unilateral lateralthoracic exanthem, and upon our research, we did realize that in fact that is what it was.